Good afternoon. So, organized medicine always throws you surprises. It's been quite a while before I saw this wonderful doctor here. And I'm glad to know that her heart is in the right place. So good afternoon, everyone. Thank you for coming on this day that we launched the Treat Yourself First campaign. My name is Dr. Edwin Bogonkor. I am a physician out of Shakopee. And I'm also the current president of the Minnesota Medical Association. We all talk about it. Burnout in healthcare is a really big deal. I don't want to use Biden's words. Maybe it's a really, really big deal. But even before COVID-19, the National Academy of Medicine found out that burnout had reached crisis levels among US healthcare workers, with 35 to 54% of nurses and physicians, 61 to 75% of pharmacists, and 45 to 60% of medical students and residents reporting burnout symptoms. Something needs to be done. That's why we formed this 12-partner coalition last year, and together we're working to end the fear and stigma that many healthcare professionals experience when in need of mental health services and support. So taking care of patients can be stressful and often takes a toll on healthcare workers. I don't think that's new. This campaign offers healthcare professionals the tools, resources, and expertise to support their well-being when needed. These tools are geared towards all members of the healthcare team, from physicians to pharmacists, dentists, nurses, physician associates, and advanced practice nurses. All healthcare professionals who seek professional support to address career fatigue, burnout, and behavioral health concerns should have confidentiality and civil immunity protections to encourage them to get the help they need. This campaign has been developed through a one-year grant from the Minnesota Department of Health. We're very grateful for that. But additional state funding is needed to implement the campaign and encourage all health professionals to treat yourself first. So with that, let's hear from Senator Liz Boldon of Rochester, who can tell you about the legislation she's authoring to help address this issue. Senator Boldon.
Good afternoon. I am Senator Liz Boldon. I represent District 25, which is Rochester area. I'm also a registered nurse. In my work outside of the legislature, I take care of patients in a hospital, and I have done that for a long time, 22 years. And as was stated, we know that burnout and fatigue and moral injury are real and present and have been before pre-COVID, during COVID, and certainly now. And it has significant impacts on our healthcare workforce, the people who are taking care of others, which then affects patient care as well. And so I'm really grateful and honored to carry this legislation that would appropriate funds for a awareness campaign for healthcare workers of all types to treat ourselves first. So I want to just say a couple words about kind of the focus of what it would be. It would be designed to reduce the stigma of receiving mental health services, encourage healthcare workers who are experiencing workplace-related fatigue to receive the care they need, and normalize the process for seeking help. It would also be targeted to communicate resources. And so this is really important for patients, for all of us. As we know, the sort of common refrain of, as we think about, on an airplane, that you put your own oxygen mask on first before you can help others. That is true, and we want to be sure that we are encouraging everyone to do that, to take care of ourselves first and support each other. So I'm honored to carry this legislation and look forward to continuing that work as we move forward.
So thank you, Senator Boldon. Now I'd like to ask some of our partners to tell us why this initiative is so important. I think we're going to start here. Introduce yourself. Who's Carrie? Right? Oh, Carrie, go ahead.
All right. Thank you so much. Good afternoon, everyone. I am Carrie Johnson. I'm a family nurse practitioner and currently the president of the Minnesota APRN Coalition. And thanks for inviting me and inviting us to partner in this. I want to address, as Senator Boldon also did, the critical issue that is also facing advanced practice registered nurses, or APRNs, across the nation, which is burnout. Recent studies show that it's extremely high, even as far as recent as 2024. 7 in 10 nurse practitioners are experiencing burnout and/or depression. 37% reporting burnout alone, and 28% feeling both burned out and depressed. This is up 27% from 2023 and up 20% from 2022. And all of that has just grown since probably like 2018, 2019, then into 2020. The most recent Minnesota Workforce Survey from 2024, with over 900 APRNs responding, when asked if they felt burnt out at work, 31% responded to a high degree or to a very high degree, with 16% planning to reduce hours and 25% planning to leave the profession earlier than planned due to burnout. So that decreases the amount of providers out in the workforce. And burnout can lead APRNs leaving the career field and severe mental health decline and an increased risk in suicide. This is not just a statistic, it's a reality that's playing out in our hospitals, clinics, and healthcare settings every day. A recent example from a Minnesota hospital where a nurse practitioner just resigned after expressing concerns about patient safety and overwhelming workloads. The departure left a significant gap in care and underscores the need for urgent support. We must address all of these challenges, and what we are doing, uniting together to provide that support through initiatives like Treat Yourself First, is outstanding. Let us stand together in advocating for our healthcare providers, not just for their well-being, which is really important, but it also then affects the well-being of our patients and communities that we all serve, because, as she said, you know, if you're not well, if you're not healthy, if you're not okay first, it's really hard to provide those services to the patients that we all care about. So thank you for allowing us to partner.
Hello, I'm Dr. Katie Smentek. I'm a pediatrician at the Mankato Clinic, and I'm the president of the Minnesota chapter of the American Academy of Pediatrics. I've treated thousands of kids in my 18 years as a pediatrician, and every day I spend more and more time in my office talking with them about their mental health and helping them learn to cope with stressors that life throws at them every day. However, when it comes to my colleagues, be it physicians, PAs, nurses, pharmacists, and others, we don't take our own advice. Treat yourself first is exactly what it sounds like, helping healthcare workers take care of their own health in order to best treat and serve others. Without healthcare providers assessing their own symptoms of burnout, there won't be many of us left. Data shows that rates of early retirement, medical school dropouts, and suicide among physicians and physicians in training are at an all-time high. Additionally, according to survey data, nearly 6 in 10 physicians have felt symptoms of burnout, including severe anger, tearfulness, or anxiety. 1/3 have felt hopelessness, that they have no purpose. And more than half of us know another physician who has considered, attempted, or died by suicide. I have brilliant colleagues in my training who are pediatric subspecialists who have left patient care due to the overwhelming strain of mental health. It's truly a loss to the medical community that could have been prevented. That same survey showed that 80% of physicians agree that there remains a stigma surrounding seeking mental health treatment. Treat Yourself First will reduce the stigma around seeking that treatment. Some of the data is just specifically about physicians, but we know similar reports exist for other provider groups. And if we continue to see these trends increase, patients in rural greater Minnesota, like those countless kids in my community I care for and keep healthy, will suffer because they can't see a doctor or a pharmacist or a dentist. From the Treat Yourself First website, sometimes we need help, sometimes we need healing, and we are not alone. Thank you.
Hello, everyone. My name is Dr. Salamov. I am an internal medicine physician. I am the governor for the Minnesota chapter of the American College of Physicians. And ACP, or the American College of Physicians, is is the second largest AMA physician group that's in the state, that's in the country. So I want to first just start by saying thank you to Dr. Bogonka and the partners behind the Treat Yourself First campaign. This initiative really is long overdue, and I'm so grateful for the collective effort to address one of the most urgent issues in healthcare, which is the well-being of the workforce. As a physician, I know firsthand the weight of the profession. These long hours, the emotional toll, the constant expectation to just push through exhaustion, through grief, through self-doubt. I have seen brilliant, compassionate colleagues struggle under the pressures of a system that demands everything from us and often gives us little in return. Let me be clear. The mental health crisis that you've heard about among healthcare professionals, it's not a reflection of an individual's weakness. It is a symptom of a system that places undue stresses on us, systems that force us to work in ways that conflict with the very values that brought us into medicine. When we talk about burnout, we're really talking about a moral crisis, one where we are asked to care for others while being denied the space, the support, and the grace to take care of ourselves. We need to name it for what it is, and we need to say without hesitation that seeking help is not a failure. Taking care of your own mental health is not selfish, it is actually essential. It is what allows us to continue doing this work, to show up for our patients, our colleagues, our family, and ourselves. The Treat Yourself First campaign is a critical step in ensuring that those who need support can access it confidentially and without fear. But our work does not end there. We must push for systemic changes that protect and sustain the healthcare workforce, adequate staffing, humane working conditions, and a culture that truly values clinician well-being, and not just in words, but in action. We should not have to choose between being great doctors and nurses and pharmacists and healthcare workers and being whole, healthy human beings. We should not have to sacrifice our own well-being to prove our dedication to this profession. So to all my colleagues that are in healthcare, this campaign is a way of saying, take care of yourselves. Know that you are seen, you are valued, and you are deserving of the same compassion that you freely give to others. Thank you.
So thank you, partners. We're all in this together because this affects us all. So I'd like to open up to questions. Anybody want to begin?
Could you recognize all the coalition members behind you?
Sure. Maybe you can, why don't you just start here, come and introduce yourself and
Sure.
say a thing or two about
Sure.
what this means to you.
Rochelle Perry. I am representing the Minnesota Nurse Practitioner Organization, and my field of practice as a nurse practitioner is mental health and addiction. And so this project is very near and dear to my heart, and I was honored to be a part of it. Thank you.
My name is Carrie Obery, and I'm the director of the Minnesota Pharmacists Association. We have hundreds of pharmacist members who are needing these resources, and I am here to amplify that message and get the resources out and do everything that we can to help Treat Yourself First reach those audience members that need it most.
My name is Mike Kurkowski. I'm a general dentist, member of the Minnesota Dental Association. I'm also American Dental Association Wellness Ambassador, a program they began in 2022. They recognized this same problem, and we're working hard. We're working on the wellness and getting everyone involved in this, so thank you very much.
My name is Leslie Clayton. I'm the representative of the Minnesota Academy of Physician Associates. I represent over 4,000 PAs in the state of Minnesota that provide over 10 million patient care visits on an annual basis. We are seeing burnout in all areas of practice. PAs practice in every care setting and in every specialty, and the impact to patient access is directly attributed to the health of the providers that provide that care. We are happy to be a part of this coalition.
Good afternoon, and with Dr. Mike Krakowski. My name's Carmelo Chiquayochi. I serve as the Executive Director of the Minnesota Dental Association. This is a critical issue for the Minnesota Dental Association and the members we serve. We are just so delighted to be a part of this campaign. Thank you for letting us be a part of it. Thank you.
All right, questions? And feel free anyone to answer.
Senator Boldon, can you talk a little bit about what you expect for the progress of the bill?
Yeah, thank you for that question. So bill has been introduced and we've got some bipartisan support, hoping to soon get a hearing in committee. It hasn't been scheduled yet, but certainly advocating for that. My partner in this work and in quite a bit of work is Rep. Liz Ryer in the House. I am told the bill will be introduced in that chamber tomorrow, and she will begin that process in that chamber as well. And then we will hope to, get it through and meet up in the middle.
Thank you.
treatyourselffirst.org.